show is here. Yo, our mission is clear. It's time to change healthcare. Have no fear. Today is the day. This is the hour. Together, you know we've got the power. Drop the silos. We're all the same team. Experience, business, tech, and marketing. How can anyone be satisfied with the way things have always been? Yeah, we've tried. So join us now. Join the revolution. Consumer first health is the evolution. Status quo, more like status no. Yeah, this is the healthcare rap. Yo, come on, let's go. New choices, new platforms, new care models. In the healthcare of tomorrow, consumers win. But who will design it? What will it look like? And how long will it take? We're here to answer those questions with some provocative thinking about how to create the healthcare that people actually want. Ready to roll up your sleeves, look at the world a little differently, and explore the frontiers of consumer health together? Join us. This is the Healthcare Wrap. Hey, it's Jared Johnson from Shift Forward Health, and here's what's going to go down today. We have the flavor of the week about Walmart's reported interest in acquiring ChenMed. As new details emerge about this potentially game-changing acquisition, are the headlines leading us to ignore some of the more important questions? I'll talk about that. Then James Gardner, our regular contributor, sits down with me to share thoughts on recent news stories, including Roz Brewer's departure at Walgreens, Blue Shield of California ripping up the PBM playbook, and much more. It's time to dive right in. Are you ready? Let's go. Flavor of the week. Are headlines about disruptors causing us to ignore some of the more important questions? Bloomberg reports that Walmart is exploring purchasing a majority stake in ChenMed, the family-owned operator of primary care clinics for seniors. As of September 8th, a deal could still be weeks away, terms aren't finalized, and talks could still fall apart. And it's also possible a different potential buyer could emerge. I've read a lot of hot takes and informed views about this story. The most common questions being asked are, can it work and will it last? But as usual, the question that I don't see anyone else asking in a meaningful way is, can this make healthcare easier for everyday people? Does this have the potential to provide access to consumer-first care for a greater portion of society? There's speculation about potential brand mismatches. Walmart's current healthcare play could be described as more accessible care for the uninsured and underinsured with full price transparency, while ChenMed's family-owned, value-based, transformative care has a seemingly airtight reputation for doing whatever it takes to keep seniors healthy. There are posts questioning why Walmart would want to take on risk and whether they just looked around at all the other acquisition-led growth strategies from their retail counterparts and realized that maybe this is one of their last chances to get in on the game. These do seem to be quasi-legitimate questions, but I want to offer a balanced view and provide some optimism. There are plenty of reasons why this could be a bad idea and fail. There are macroeconomic forces at work, such as CMS's proposed rule for reduced physician fees in 2024 that are causing everyone to scramble. But that doesn't mean that a potential partnership here can't or won't work. From my limited understanding based on interviews with senior leaders from both organizations, I'm bullish that there's a potential roadmap here that provides shareholder value and greater access to consumer-first care. And whether it's these guys, or Amazon and One Medical, or CVS at Oak Street, or Walgreens and Village MD, or United and Optum, or someone else who has yet to put their money where their brand is, it's clear that non-traditional players are pursuing success in different avenues than traditional provider organizations. And when someone finally cracks that code, we might wonder why we weren't more focused on consumers' needs all along. Let's keep a balanced view of every reported new deal so that we can keep consumers at the center of innovation. That's another way that we'll build the healthcare of tomorrow. And that's the flavor of the week. The flow. All right, everyone, let's get into the flow. It's time once again to welcome James Gardner to the program. James, welcome back.
Jared, it's delightful to be here. I've missed chatting with you.
Yeah, it's been a little too long, but what have you been up to?
Oh, just coming off an incredible summer. Some folks may have seen some pictures I shared of a canoeing trip up in Alaska. That was definitely bucket list material. So if that's your thing, reach out to me. I'll share more pictures.
Outstanding. Yes, that wasn't just like a 1 or 2 day trip. That was several weeks, as I recall.
Yes, it was. Yes, it was everything. How about you?
Myself, well, it's what I'm gearing up for. Personally, I'm actually gearing up for my annual Grand Canyon hiking trip. So this year's going to be a little longer, where we're going rim to rim. So I've done rim to rim each of the last few years, and we're looking forward to that, but we're going to go there and back. So that's going to be awesome.
I'm excited that we both share such incredible passions and that we're still able to pursue them.
It is. You got to find time for that. I want to tell you one reason I was excited for us to get back together today is healthcare never seems to be short of headlines. There's so much going on. I thought it might be good just to synthesize what we can make of a few things that we're reading about, hearing about, watching, other go down at this time. There's never a dull moment.
Indeed.
And I don't know if it's necessarily like full sea changes that are going on right now, but there are some signals of things that are to come that are always worth keeping our finger on the pulse and seeing what it could mean. There are a couple of things that have been described as game-changing or maybe the first domino to fall. So why don't we just go back and forth on a couple of things that we've seen and been reading about, and I'd love to hear your point of view on things. I think the one that's right in the middle of that radar screen right now is the leadership change at Walgreens. So as many of our listeners know, Roz Brewer, who's been the CEO a little less than 3 years, is stepping down. And so Walgreens' healthcare playbook or strategy, if you will, can certainly be construed as possibly being up in the air there. What have you heard? What have you read? What do you think about that?
Well, first of all, let's give a shout out to Roz. She's an inspirational leader and came to Walgreens with an amazing pedigree, longtime CEO at Sam's Club, which is part of the Walmart empire, but more recently was the chief operating officer at Starbucks. So obviously a highly credentialed and respected leader. So we wish her the best, wherever her path takes her. But yeah, her departure was unexpected, although perhaps somewhat expected in hindsight. Most obviously, the Walgreens stock has performed abysmally. It's trading recently where it was 15 years ago, and that's coming off a really rough 2023 and a really challenging August in particular. So we can appreciate, there was pressure on her to make things move faster. She made a lot of bold moves, some really sizable acquisitions, but perhaps there were questions about the wisdom of those or the ability of the team to actually deliver short-term results. And it came on the heels of their CFO departing earlier in the summer. So maybe in hindsight, the writing was on the wall. I don't know. What say you, Jared?
Yeah, I mean, a couple of thoughts. I mean, first and foremost, I agree. Hats off to Roz Brewer and the leadership that she's provided over these years. She came on at a time when Walgreens hadn't really made clear its healthcare roadmap, publicly at least. We didn't know what they were intending to do, how many billions of dollars they were intending to invest in acquisitions and where they wanted to go from there. We still primarily knew them as the corner drugstore. And there were the beginnings of this journey kind of being made clear at that time. But I would agree that she has provided leadership during a pretty substantial directional shift for them and expansion. And we definitely don't consider that easy in any sense of the word at any point. One of the interesting things that came to mind to me was a couple of comments that I read from analysts. One was by a reporter in the New York Times that said analysts were growing weary, kind of to your point of the lack of healthcare leadership. Or maybe that can be construed in so many ways. Is that lack of understanding of what it's going to take to create a consumer health brand or a retail health brand in the midst of a consumer brand. I mean, to your point, Roz's background was from Starbucks. There's a learning curve, no matter what. And so the flip side of that narrative is one that we want to be careful to convey at any point, which is it's so quick, and maybe I'm just attuned to it. I see it all the time. Reactions to any headline of anything, any change, any leadership change, any downward financial performance for any consumer brands in the space, people go immediately to see healthcare is complicated. See, look how hard that is. See how challenging it is. Just let us, traditional providers, just let it stay with us. We'll keep doing it our way. And I think that's always been a little troublesome to me, that quick leap there. I think there is some truth to that, but the quick leap of saying, nobody should be in this space. I can't believe they even tried. Let's just let healthcare be provided in the same way it's always been. There's always, a glimmer of hope in my mind I do feel like there's some place where everyone can coexist here, But it is not easy. And I think when we see the same things happen at Amazon or Walmart or wherever else, we see those same things. So that's where my mind goes as part of this story. And again, not knowing not even close to any inside information. I don't know what was behind this change other than, to your point, some very disappointing stock performance, financial performance for the company.
So in the meantime, they've named an interim CEO, a fellow board member. And as I understand it, there's an executive search underway to find a replacement. And we'll be watching the profile of that new hire. But to your point, I think we could expect to see someone with a more traditional healthcare background or someone who has a background at the intersection of retail and healthcare, which is a challenging unicorn to find.
Well, that's a really small pool.
It is. Yeah, it is. So we'll be watching that situation closely.
There are a couple of other leadership moves that have either been announced or taken effect. And I do think these are kind of in different buckets. There are different circumstances with each of these. But the CEO of One Medical, Amir Dan Rubin, is leaving at the end of the year. He's been there 6 years. It doesn't appear, we're not reading anything that's linked to any financial performance or anything like that it was unexpected necessarily. He's been there a while. He oversaw this transition to the Amazon umbrella here. Are you seeing anything, reading anything, or what do you think about that move?
No, again, we don't have any insider information, but it would seem to me that when there are acquisitions, oftentimes the leadership stays on during the transition contractually as part of the acquisition arrangements, but they're free to move on after, in this case, just about a year. So that's an important milestone that contractually he probably had obligations, but maybe he wants to start another company or go into something smaller than the Amazon juggernaut. I did notice that the COO of One Medical is stepping into the leadership role. So that suggests that Amazon's staying the course. They're not dramatically doing a 360 and revisiting strategic decisions and whatnot. That was just a footnote I noticed in parsing the news that I was reading.
Yeah, interesting. And then the third one, so these all either took place or were announced August 31st or September 1st. So all within a day of each other. But Daniel Fink, that was the president of Aetna, that was announced actually back in April, but he was stepping down for health reasons. And so Brian Kane is the incoming new president of Aetna. He had been the CFO previously, so he oversaw their primary care business there. So yeah, not a big step there. And again, for what appears to be an unrelated reason compared to the other two, but it still goes to show, it just brings up this fact to me of, I think I mentioned it last week in the flavor of the week or recently, of just, I want to acknowledge the challenge that exists for any incoming leader for any of these organizations, because the reality is that, and I think this is where people's minds go to right off the bat, is that the vision of retail health doesn't necessarily align with shareholders' quarterly expectations. And that's just part of the reality. So you bring in an incoming leader in any capacity for whatever circumstance, and that's the reality they face. They still just have 24 hours in a day, right? Like, it's not like, regardless of how magical anyone thinks they can be, there's still only so much they can do, and they're limited by not only the restraints and constraints of the industry, but also the financial performance of their organizations. It's just an additional layer of complexity to what's possible. I think most people out there are rooting for more options for healthcare. I'd like to believe that.
Of course.
It's just that thought of, well, where does it come from, and why should they get to do it? Why shouldn't somebody else do it instead? So yeah, it's just that confluence of factors when I see announcements like this.
Your point is well taken. This is not a time for anyone to be smug. Because we all live in glass houses, and throwing stones accomplishes nothing. And you're right on that. There's an unbelievable number of moving parts and complexities that make these jobs some of the toughest in the world, never mind the industry.
For sure. All right, James, let's go to what you're thinking, what you're seeing. What are you seeing out there lately?
Well, I've been following some breaking news in the world of generative AI, or generative artificial intelligence. Known to most of us as ChatGPT, but there's obviously other examples. And I've been following developments amongst some of the major publishers in the online world. We're talking the New York Times, Disney, Reuters, and whatnot. And they're reacting to growing anxiety about the use of their content, which obviously has immense value, was created at immense cost, given its quality and the fact that they're investing in really high quality journalism. And they've made moves to block ChatGPT's web crawlers, which effectively shuts the learning model out of using that for training purposes. And they're asserting that they know that some of their content has already been consumed and is in the learning model, and in their minds that violates copyright. So that's an interesting collision between two giants in the world. But I ask people in the healthcare world, what does this mean for us? Obviously, we're not publishing giants, but many of us actually do create a substantial amount of original high quality journalism or research. We know that it's being incorporated to training models. And it begs the question, how do we feel about that? Is it something that's actually a problem, or is it something that actually is aligned with the academic mission of disseminating knowledge? So that's a bit of breaking news, and I would encourage everyone to give that thought. How do you feel about your content being consumed and being incorporated into training models? Does that concern you, or actually does it excite you? And I think there's a case to be made on both sides of that argument.
Yeah, isn't this kind of an extension of the entire debate of publishing healthcare-related content from established medical institutions way back in the early days of social media and SEO and organic content, and that being a keystone of marketing strategy, which it's still a big piece of a marketing strategy, but it is not as much of a keystone as it used to be. It's not one of those key parts of a strategy, simply because there are only so many other channels we have to figure out and have as part of your strategy.
I think the crux of the concern here, and what makes it different, I think, from traditional search optimization is traditionally search results lead to a click-through and a visitor to your site where you can theoretically monetize that interaction, convert them to a customer, or maybe extract a donation or whatnot. With AI training models, they're consuming your knowledge, but then they're transforming and synthesizing it, and the visitor never ends up on your site. In fact, you're not even getting citations in a lot of cases. So even if someone wanted to get to the source of the knowledge, they can't do that. And that really rubs a lot of people the wrong way.
It does. So that's the evolution, right? So it's been referred to as zero-click content. Yeah. So the phenomenon that less than 50% of any search results, at least in Google, lead to a click outside of a Google property. So that continues to drop year over year.
Yes.
So that's one of the realities there. From a marketing standpoint, I remember that being just such a revelation, I guess, when I'd see someone like Cleveland Clinic and what they've been able to build, which is not only lauded by other healthcare institutions, but by the content marketing world at large. Everyone recognizes the value of what they're doing and acknowledges how much of a leader they are in the space. So the volume of content they've created, the volume of traffic they've been able to generate to that content, the business value they've been able to derive from it, I don't know of anyone who does it bigger or better. So yeah, they're going to be at the forefront of that discussion. What do you think, if you're like a marketing leader at a hospital or health system, what are you thinking are the possibilities of it affecting something you're doing?
Well, I sense that many organizations are going to find themselves between a rock and a hard place. Obviously, there's concern, and Amanda Todorovich from Cleveland Clinic weighed in on my LinkedIn post and acknowledged as much, that they're concerned about their investment in publishing and content. They know the value of what they've created and the effort that went into creating it. At the same time, they do feel the larger academic mission of Cleveland Clinic to disseminate knowledge to the world and improve healthcare for everyone. And that's a direction that would suggest making your content available to Google, making it available to OpenAI. And it's obviously the source of much discussion at Cleveland Clinic, and it should be the source of discussion wherever great content is being created. I'm thinking Mayo Clinic, I'm thinking Johns Hopkins Medicine, and other leaders where there's an archive of just really, really valuable content that should not just be the subject of apathy. It needs to be the source of discussion and debate as to what the right strategic direction should be.
Yeah. So if this falls the same way as other major developments that were just consuming our attention, at least in the digital marketing realm back in the day, it always feels like there's either a leader or a player like a Google, someone who changes the rules or Apple, who says all of a sudden, okay, I know you're all worrying about this and this. Here's how you have to do it. These are the rules you have to play by. Like, we're just going to set that for you. And everyone gets to play by those rules. At some point, somebody, it seems like, might have to lead a general direction. Right now, I just hear a lot of questions and not a lot of answers. Rightfully so. This is breaking news, to your point. This is something that it's not like somebody seems to have figured out right away, or at least not what I'm seeing, that a lot of institutions are just starting to ask the questions and recognize the potential impact on their ability to derive any value from content that they're creating. Like, to your point of what Amanda shared on your post.
I'll just add, and then we can move on. There's also the reality that if you don't share your content with OpenAI, that important factual information that you actually want in the public sphere won't be picked up. And I'm thinking like clinician profiles or locations. If those aren't part of the learning model, ChatGPT will rely on third-party sources, many of which might not be reliable or accurate. So that's also a consideration, that you want your information portrayed accurately in the public sphere. What else is on your mind? We've kind of beat that topic around.
No, I think that was great. Well, it was another flavor of the week that I recently just dove into just a little bit, which was the Blue Shield of California, their move to end their 15-year PBM relationship with CVS and replace it with a couple of other players, notably Amazon and Mark Cuban Cost Plus Drug Company. Then they also have a company, Abarca, to process their drug claims. So the piece I read was about whether this is ripping up the PBM playbook. And so, the thought was that, is this basically a first domino to fall? Like, is this providing a roadmap for other health plans to change the status quo? And that's what caught my attention. I'm reading some of the quotes from some of the leaders involved, especially Paul Markovich, the CEO of Blue Shield of California. He just said basically like this is incredibly complex, but it's designed to flip everything on its head, the current pharmacy supply chain. He calls it a forest of opacity and profit.
Yes.
I thought that was interesting because those are still existing relationships. And the point that CVS is still going to be used, CVS Caremark is still going to be used by these guys for specialty drugs. So especially for patients with complex conditions, but the online pharmacies will provide services for everything else. So Amazon and Mark Cuban, Cost Plus Drug Company. I guess where it drew my attention the most was, first and foremost, that disruptive thinking, the innovative thinking of, I know everyone's done it this way. We've done it this way for the last 15 years just with CVS. But
Yes.
Is there another way to do it? They were motivated, at least outwardly, by cost savings. So this plan is expected to save the company $500 million a year when it's fully operational. That's not until 2025, but that's about 10 to 15% of their total costs for prescriptions. So that's always been part of like the yin and yang of providers versus health plans, right? There are some natural incentives for a health plan to find cost savings and to roll those back to a member. They're trying to provide value to a member versus provide a service to a patient. And there's a lot of intersection, but there's some yin and yang there, if you will.
It's a fascinating situation. I agree. And if nothing else, we should applaud Blue Shield of California for making a bold move. PBMs are notoriously complex. I won't even pretend that I understand their economic model, but we know it's incredibly lucrative. We know the spend on pharmaceuticals is immense. The fact that you can save $500 million a year, that's still only 10 or 15% of the total spend. So the size of the spend is just staggering. I guess what I'll be watching is, will other insurers make similar moves? If so, that'll be crushing for the Caremarks of the world, the Express Scripts of the world, and other leading PBMs. But to date, I think it's a one-off.
Yeah, it is. It is. From what we've seen, we haven't seen any other dominoes fall, so to speak, at this point. The other interesting part of it was, if they really are saying that that's their potential cost savings, that's their expected savings, but they also said that they will be rolling back some of those cost savings to their members as well. And I'm like, okay, that's on public record. That's in a couple of stories. And like, so, it remains to be seen. It doesn't even start taking effect until January of 2024. It's not fully in effect until the following year. So there's some time before we know whether or not that's the case. But the fact that they're saying like, we are motivated to do this. This is why we're making this change. And we will be rolling, some of those costs savings down to our members. That's not typical language, I guess, that I hear, at least again out in the public sphere, out in a news story. And I like that. I like the motivation to do something that's good for the business and for the consumer, because here we are sitting a lot of times on the provider side of things, you and I in particular, and Zane as well. We do bring up a lot of consumer brands or non-traditional brands that are providing healthcare services now, but we're still mostly on the provider side, and we don't dive as deep on the health plan side for the most part. Maybe that's just our backgrounds or whatnot, but consumers still think of it all the same. I need to go somewhere to fill up, to get a prescription, and I need somewhere to fulfill that prescription. And if someone along the way is making that easier, then that benefits the consumer.
It does.
It is. Yeah, it's part of that consumer experience, if you will. And it's just a good reminder to me, I guess, ultimately, to not think of consumer experience as just what's being provided by the provider. There are other aspects of a healthcare journey and even a health journey that are part of a consumer experience that aren't always coming from the provider. And so it helps me to open my view a little bit.
I think that's a really important point. And I think most people would acknowledge that the payment for healthcare services is perhaps one of the most broken parts of the healthcare journey. Insurers are notoriously unliked. What they're selling is very complex. We prefer not to have to buy it at all. And then when we do go to use it, we realize all the limitations inherent in prior authorizations and reimbursements and whatnot. So to the kind we're focused, you and I and Zane, on the holistic consumer experience, we probably should be paying more attention to the payer side of the equation.
Yeah, I agree. I think there's a lot we can learn there, not just because they are naturally aligned in some ways to add either preventive measures, preventive healthcare, food as medicine, a lot of things that when you're looking at a whole health view of things, how do we improve the healthcare of, the people in this country? How do we reduce costs? It's not just improving things in their individual silos. And I guess that's another reason maybe why this caught attention, was that they were willing to challenge the status quo and they feel like they have a way to do it successfully. And that's bringing up a mindset that we still just don't see that often. We see a lot of big claims of revolutionizing healthcare, and then we see those kind of crash and burn a lot of times at all sizes and shapes. So yeah, I agree. I think it's a great reminder there.
I'd ask our listeners if y'all are connected in the world of payers, and disruptors and people that are focused on the patient experience and the patient journey the way we are, let us know. We'd love speakers, we'd love insight, so that we can do justice to the role they play in the delivery of care.
Absolutely. Thanks for bringing that up. Anything else on your mind, James? I'll swing that back to you. Anything else we haven't discussed?
I'm watching with some interest a move by primary care physicians at Alena Health in Minnesota to form a union. Did you see that in the news, Jared?
I did.
And what's your take? It's obviously unprecedented, I would think, for professionals, among them physicians, of course, but also I believe PAs and NPs are joining this move. As I understand it, driven by a sense of disrespect, perhaps, lack of fair compensation, poor hours, just a general unease with the work environment. And I don't understand yet if the union has been formed or if they're just taking it to a vote. But that could be something that spreads to other systems, because there certainly is a lot of anxiety and unhappiness around compensation and around staff shortages and all the things that go into a happy work environment. Did you have a take, Jared?
Well, I think just at a surface level, again, no insider information. I just read a story or two about it too. And, the very first thing that came to mind was just the thought of, okay, if doctors and other healthcare providers feel the need to unionize, like something's not right. The traditional, historically, at least over hundreds of years, right? The Industrial Revolution, right? Unionizing was primarily for a certain class of workers who felt disrespected for it sounds like a lot of the same reasons. They knew they deserved better compensation. They deserved better conditions. They felt disrespected. This is the way for them to change those things. So now you're sitting at people who are in many cases near the top of that economic food chain who are feeling that way. Mm-hmm. Like this is just at a macro level. How many years now have we heard, doctors and nurses and PAs, providers are feeling burnt out, but now someone's doing something about it. And they're not just saying, you need to hire more doctors. I can't work 100 hours a week, 100 plus hours a week. You're killing us. Someone's doing something about it. And you're right. I don't know what stage it is now, if something has been formed, if it's just gone to a vote, but the thought of just, here's where healthcare is right now. I think that's where my mind goes. That feels like an imbalance, a disturbance in the force, if you will. Like something's not quite right anymore.
Yes, it is. It should be a wake-up call for leaders at other health systems. Ask yourself how your clinicians are being treated. And if you've got nurses or doctors that are being overworked, that aren't being compensated fairly, or they're not being respected, this could serve as a catalyst for unionization moves nationwide. It introduces yet another complexity into the operating of a health system to have a unionized workforce. It's sad and disappointing that it's come to this. You should never get to this point where people are that angry or that unhappy.
Yeah, agreed. Well, that's great. I think we covered a lot today. I think there's, as always, like we said, things are always moving. There's going to be a continual evolution of a lot of the topics we discussed now today. But I want to thank you, as usual, for joining me and sharing your perspective on these things.
Oh, thanks for having me, Jared. I always enjoy these conversations. And you're so right. There's never a dull week in the healthcare world. So let's do this again, and sooner rather than later.
For sure. I want to thank James Gardner for joining me on the show today. And I want to thank everyone for listening. Tune in next time.
Thanks, Jared. Thanks, everyone.
Thanks for tuning in. If you like what you heard, please spread the word. Tell your colleagues to tune in for all the awesomeness, then leave a review on Apple, Spotify, or wherever you listen. This show is produced by Shift Forward Health, the channel for changemakers. Subscribe to Shift Forward Health on your favorite podcast app, and you'll be subscribed to our entire library of shows. See our full lineup at shiftforwardhealth.com. One subscription, all the podcasts you need, and it's all for free. And remember, we might have a lot of work to do in healthcare, but we'll get there faster together. Thanks again.